Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Berry aneurysm. So what is special about this? This is the most common type of intracranial aneurysm. So we have the important diagram. So in this will be the anterior communicating artery. This is nothing but the posterior communicating artery. This will be the posterior cerebral artery. Then comes the basilar artery. Next is the internal carotid artery. Then comes the anterior cerebral artery. Now let's go in detail. It is a saccular in appearance. This will be saccular. So it is saccular in the appearance and it arises from the bifurcation of the intracranial arteries. So bifurcation of the intracranial arteries. Next is 85%. It occurs in the anterior circulation of the circle of Willis. So anterior circulation of the circle of Willis. So what are the commonly included locations? So it can include the anterior communicating artery and the anterior cerebral arteries. So this is the most common. So here it is about 40%, and then the middle cerebral arteries bifurcation is the second most common. The next others, it includes the posterior communicating arteries, the internal carotid artery junction, that is the third common. Then comes the intracranial carotid bifurcation. This is the fourth common, and then the vertebro-basobasilar, and this is nothing but the fifth most common, or the basilar artery bifurcation. Next we look at the risk factors. So what are the risk factors? The risk factors of berry aneurysms, it includes smoking, as well as in case of hypertension. So structurally it is very abnormal, that is, it is absence of the smooth muscles, next is also the intimal elastic lamina. So there's absence of the smooth muscle as well as intimal elastic lamina. The wall of the berry aneurysm is made by thickened. So wall is made up by the thickened hyalinized intima. So structural abnormalities, there is absence of smooth muscles and intimal elastic lamina. The wall of berry aneurysm is made by the thickened hyalinized intima. Now what are the conditions associated with the berry aneurysms? The conditions are, it is FMD. FMD stands for the fibromuscular aneurysms. Next comes the Marfan syndrome, fibromuscular dysplasia, then the Marfan syndrome, then the hellodrhub syndrome. Next is the coarctation of the aorta, as well as the NF1. NF1 is a neurofibromatosis 1. Now let's move on to the clinical presentation. So upon clinical presentation, it includes the ruptured berry aneurysm and it leads to the intracerebral hemorrhages, the SAH, or it can include the both. The most common site of the rupture is the dome or the apex of the aneurysm. The unruptured berry aneurysms is typically it is asymptomatic. It is asymptomatic. Now how do you manage this condition? So management is by the endovascular. So there is endovascular occlusion. This is greater than the surgically clipping. Then comes the craniotomy of the surgical damage. So by the craniotomy or the surgical drainage. What are the complications of this? The complication, it includes the rebleeding, the hyponatremia, the vasospasm, hydrocephalus, as well as presence of the seizures. To learn and grow daily like this, please do subscribe.